Okay, so continuing with our respiratory disorders, and now we're going to actually go over emphysema first with COPD. So COPD is a combination of chronic bronchitis and emphysema. Okay, emphysema. So let's talk about a healthy lung first. So a healthy lung has something called elastin. When you hear the word elastin, I want you to think elastic band because it's stretchy and it goes back to its normal position afterwards. So elastin is a major component of the alveoli. It gives the alveoli the elastic property, and when we exhale, air goes out by itself due to the elasticity of the alveoli. Then we have elastase. So elastase is a protease inhibitor, and what that does is it breaks down the elastin for new tissue growth. Normal process. We also have something called alpha-1 antitrypsin. This is made in the liver, and it inhibits elastase. So it inhibits this elastase to make sure that we have enough elastin. So what is emphysema? Emphysema is too much elastase. So if we have too much of this enzyme, then it breaks down elastin, which means that we don't have the elastic property in our alveoli as we normally do. So what is too much elastase? So as we know, emphysema is too much elastase. So how does it develop? Well, we get irritants enter the lungs, such as smoking and air pollution. We have our inflammatory response. When that happens, neutrophils go towards that inflammation. Our neutrophils actually make elastase. So if they make elastase and they're going towards the inflammation, now we have too much elastase. And remember, this breaks down the elastin. Also, that inflammation damages the cilia, so we have less movement of the mucus fluids in general to help get rid of the irritant. Also genetically, we talked about that alpha-1 antitrypsin that is also in our body. So with this, in the genetic system, we have a deficiency. So you can have a genetic deficiency of alpha-1 antitrypsin. So if we have a deficiency, it does not inhibit the elastase. So if it doesn't inhibit this, then we also get too much elastase. And this is with the genetic component. Okay, so too much elastase, what does that mean? So remember elastin, think of elastic. And so when we don't have that, our alveoli become large and floppy. There's no recoil because there's no elastic property. The alveoli does not properly deflate. So when that happens, air gets trapped, and so then we get hyperinflation. Our diaphragm flattens and cannot help with our breathing, and our accessory muscles are used to breathe. The inflammation, the cilia is damaged, like I just said, so less movement of fluids and mucus, and our mucus and fluid gets trapped. With this, we get low oxygenation, increased CO2, and gas exchange problems. So let me show you a couple things here. This is our regular diaphragm here, and our diaphragm helps a lot with our breathing, our inhalation and exhalation. If we have increased alveoli size, because the oxygen is and the carbon dioxide is not being exhaled properly, then our lungs become larger because the air is trapped in the alveoli, and it pushes down on the diaphragm. When it pushes down on the diaphragm becomes weaker and can't help us breathe as well. It's being constricted. So now the patient has to use their chest accessory muscles in order to do the breathing. Here's a picture of the damaged alveoli. This is a good example here. This is our normal alveoli, has good muscle strength, a lot of elastin to push the CO2 out and let the oxygen in. This is damaged alveoli, so it's all floppy because there's no elastin property left. And so the air will come in and the alveoli becomes deformed. It gets trapped and the CO2 gets trapped in here. And then there's nothing to push it out again, so this becomes larger, and that's when we have our increased lung capacity size.